a chiropractor. You expect to have your neck or your back adjusted. 9 Wants to Know has found a business hired by insurance companies that is also adjusting your bills. Investigator Deborah Sherman joins us. And Deborah, your investigation began after some of our viewers took a close look at their explanation of benefits.
Mark, the numbers just weren't adding up, so we spent months reviewing health records, and we found something most patients and doctors don't know. A billing company called Columbine Health Plan has been making millions by inflating your doctor's bills and adding services. You might be surprised to learn that Columbine says it has deals with 2 of Colorado's largest health insurance companies that allow it to happen.
I want to mobilize the shoulder here a little bit.
Jeremy Hayes loves sports.
I like to boulder and mountain bike.
It's just that
I tweaked my back originally skydiving.
he's not very good at them.
And then I hurt it again in a motorcycle accident.
Jeremy is a good enough sport to let us videotape his appointment with chiropractor Greg Crawford and follow his health claim. We would like to ask you some questions about that.
Some of the time.
As it goes through this biller. David McReynolds owns Columbine Health Plan in Denver. He bills insurance companies for 350 chiropractors. He says it's more efficient and affordable for everyone. But when we looked through 50 bills for more than 30 patients, we found that Columbine's been making millions off patients and insurance companies. Watch what happens with Jeremy's bill. When it leaves the chiropractor, it's $36. Columbine then raises the fee 69% to $61. Columbine sends that bigger bill to the insurance company Cigna. Once Columbine pays the doctor, its take is $16 or 35%. Now multiply that times hundreds of thousands of visits.
It doesn't happen once in a while. It happens. They change our fees on most charges every single time.
Did Columbine ever tell you that they'd be inflating the prices of your services?
No, we had no idea that they were actually raising our prices to get to wherever they wanted to be.
That's not all. We also found Columbine's been adding treatments to bills that were never performed on patients. Extra services? The doctor only gave this patient a $45 trigger point therapy, but his insurance claim shows Columbine also billed for a $61 back manipulation. That makes the total $106 instead of $45.
It's important that we're not gouging the system, and I think that's what's happening here.
McReynolds says he doesn't really add services. He only changes the codes to get paid. But all those changes make the bills confusing and the hidden fees hard to spot. Where do they come up with the $61? Susan Havcost first thought her doctor overcharged her. I'm paying more than I should be. Then she learned Columbine was nearly doubling her doctor's bills and draining her benefits. Should Columbine be doing it? Is it ethical? You know, to me, it's not. Here's something else. All of those changes make your health statements wrong. They're so wrong, this doctor decided to warn all of his Kaiser patients that he's not really making hundreds per visit.
Initially, they're very upset with me. And I do wonder if I've had some patients that have gotten that statement and thought that I was paid $180 and didn't come back. That's sort of the fear that I have.
Patients have complained to insurance companies and the state, but nothing's changed. More doctors say they'd also speak out, except this paragraph in their contract with Columbine says they'd be fined $5,000. There was only $6. So we showed what we found to Dr. Mike Springfield, who didn't sign that contract. He's president of the Colorado Chiropractor Association.
They changed, let's say, a calf stretch to a spinal manipulation.
They actually are adding services here that were never performed.
That's correct.
Billing companies, he says, shouldn't do that.
You need to bill for the things you do. I mean, that's just common sense. And if doctors don't bill for what they do, they get in big trouble for it.
Instead, McReynolds is making big money. He can afford a home in Aurora, horse property in Fairplay, and a vacation getaway in Scottsdale. He donates hundreds of thousands of dollars to Republican candidates and causes. Governor Bill Owens even proclaimed June 16, 2005, David McReynolds Day. He wouldn't sit down for an on-camera interview, so we caught up with him on his way to work. What would you like to say to patients who are losing their benefits because of this? So you're going to be making any changes because of this? Are you considering that?
No.
He says Kaiser and Cigna know about and approve all of his billing methods.
Everything we do is pursuant to contracts that we have, both with our doctors and with our payers.
Overall, he claims Columbine keeps costs down.
Does that hurt at all?
Even if for some, it's financially painful. You'll never know if Columbine's been charging you extra unless you ask your doctor. McReynolds hired a lawyer and sent us statements, and Kaiser and Cigna sent us emails. We've posted all of it online for you to read, including the doctor's bills with the extra charges. If you have something to say about this, you can call or email Cigna, Kaiser, and the Attorney General's office. Mark.
So, Deborah, with so many complaints about Columbine, how is it they're still doing business this way?
Well, you know, that's just one question that we asked the insurance companies that they would not answer. We've learned there's no state agency that oversees third-party administrators. That means no one is watching, Mark.
So much of the healthcare problem is a conundrum, isn't it?
It really is, and it costs us all overall in higher health insurance fees.
Yeah, everybody pays. All right, Deborah, thank you very much. And Deborah will have even more about this tomorrow night. We've streamed all of the documents for you on our website at 9news.com. If you would like to take a look, log on and click on the Adjustment Bureau on the... You know, an investigation by our 9 Wants to Know team gets the attention of the Colorado Attorney General's office. Chiropractors tell 9 News a state investigator is looking into a company that we exposed doctoring patients' bills. Also tonight, one of the company's employees admits that it's happening. Investigative reporter Deborah Sherman is joining us now with this follow-up report. And Deborah, you actually caught an employee admitting to changing patients' bills.
Some patients have called Columbine Health Plan to ask about their chiropractor bills, which show extra charges and procedures that never happened. While the owner of the company told 9 News he does not add extra services to bills that weren't actually performed, you're about to hear a different version from his own claims manager.
Why don't the codes match up?
You're listening in with 9 Wants to Know.
It just would make all this easier and I wouldn't have this headache of trying to figure out.
As this patient tries to get answers from the billing company Columbine Health Plan.
How do you say he got an adjustment and he didn't get an adjustment, he got trigger point?
Her explanation of benefits from the insurer Cigna shows Columbine charged her husband for an extra $61 procedure.
Why would you bill for a different service that wasn't performed or done?
While we're not broadcasting the claim manager's voice, we can tell you what she told the patient. Sometimes Columbine has to add extra services, she says, in order to get paid by Cigna, even services that never happened. Our investigation found that's how Columbine's earning millions while costing some patients important health benefits. Records show after Columbine gets bills from chiropractors, it increases some fees and adds extra services before sending the bills to the insurance companies.
I'm paying at an inflated rate.
Patients like Susan Havcost end up personally paying for the higher fees out of their health savings accounts, which is cutting their access to some healthcare services nearly in half.
There really is no excuse.
Joe Ramos is a doctor and an attorney who specializes in legal medical cases.
Whenever you are changing providers' codes, when you're changing a description of the service, there really is never justification for that. That is a big red flag that there are problems here.
There have been other red flags. We've learned patients and doctors have complained in the past few years to the state and to insurance companies Cigna Health and Kaiser Permanente. Despite that, Columbine's practices have not changed. Cigna won't answer specific questions from 9 News.
Who are losing their benefits.
Columbine Health Plan owner David McReynolds says his contracts with the insurance companies allow him to adjust the bills, but confidentiality agreements don't allow him to prove it.
We'll have to talk to you about that later, okay?
To stand back and say we're protected or we have a contract is not good enough. There's a legitimate concern here about the changing of codes, about billing for services that were never provided, and changing prices.
Since Columbine didn't tell any of its 350 chiropractors or 500,000 patients that it's changing bills, we're getting lots of calls and emails. Patients want answers from the insurance companies, and some are writing lawmakers, hoping to get legislation passed so this kind of billing doesn't happen again, Mark.
And in fact, a lot of people are blaming the chiropractors for all of this.
They are, but it's really not their fault. We've reviewed about 50 bills, and they all were perfect when they left the chiropractor's office. Now, the bills only change when they go to that third-party administrator, Columbine Health Plan. So they leave perfect, and then they are changed
Or adjusted up.
in the Columbine Health Plan.
Right. Oh, fascinating. All right, great story, Deborah Sherman. Thank you very much.